Hi, my name is Mike Clark. I'm here on behalf of Dr. Dan Purser and myself. We'd like to talk about genetic health profiles for kids. Now, what I would like to do today is help you learn why, in our opinion, every parent, grandparent, should have a genetic health profile of their child, their children, or their grandchildren. Now, who am I? My name again is Mike Clark. I have some experience in different fields. I particularly am in functional medicine is my primary goal right now, primary field. I'm also a certified brain health coach and in brain fitness. I'm also a certified trainer in genetics. And genetics is what we want to talk about today. So again, the subject of this talk is why every parent should have a genetic health profile of their child or their children. I also say grandparents, of course, because I am a grandparent. I'm the founder of Seeking Perfect Health in Austin, Texas. Our goal is always to seek perfect health. It's a journey. I was a founder of the Natural Biohealth Clinics, which was one of the first bioidentical hormone clinics and functional medicine clinics, at least in the state of Texas. I have a doctorate degree in natural health, and I have a diplomat in the clinical science of anti-aging and functional medicine. I'm also a fellow and advanced fellow of anti-aging, recreation, and functional medicine. At my age, I obviously am very interested in anti-aging and longevity medicine. So this is my grandkids. I like to show them because I've had them genetically tested, of course. As soon as I got involved in genetic testing field, I immediately did all my kids, all 4 of them, and my grandkids. Now we all know that there's lots of problems out there, and it seems to be growing bigger and bigger with our children. Here are just some statistics on the number of children and adolescents that are taking psychiatric drugs, and some of them are as low as 1 to 3 years of age. So just to give you an example, 0 to 17 years of age, psychiatric drugs themselves are being prescribed for over 7 million kids right now in our country. ADHD drug, what seems to be rampant and seems to be growing, another 3.6 plus million are prescribed those drugs. And these are all different drugs, by the way, prescribed for different kids, and sometimes multiple drugs, unfortunately. Antidepressants, again, over 2 million are being prescribed for our kids, and antipsychotics, almost another 2 million. So other psychiatric drugs, and this is just from 0 to 5 years old. I'm talking about kids that are very young, not older than 5 years old. We have over 500,000 that are being prescribed these type of drugs. So what can we do about it? One of the things I think it's really important that we know our child's genetic risk. Now, the genetic health profile that's being provided by Dr. Purser and myself, it can provide you information about that his or her potential risks, for example, from vaccination. We know there's a lot of dispute about vaccinations, but we do know that it can cause inflammation. And as you'll see later on, some of these kids, because of their mutated genes, can be have high aggressive inflammation. So those are things you just need to know about, and you'd want to share with your pediatrician, of course. Your child's genetic health profile can also give us early notice of potential risk for ADD, ADHD, autoimmunity, autism, anxiety, depression, low energy, sleep issues. You say, now where do all these come from? Well, they're all happening now to our kids in greater and greater numbers for a variety of reasons. Now, the genetic profile can also provide early guidance for the benefits of a gluten-free diet, adding prebiotics to probiotics. Sometimes you'll see a genetic mutation that will say that probiotics by themselves won't work for this particular young man or young woman. A low inflammatory diet, again, you'll find mutations that show the particular child has very aggressive inflammation and gets turned on fast and doesn't get turned off very well. That also would apply to certain vaccinations and series of vaccinations. And personalized recommendations for natural vitamins and natural foods. Now, we always stress you share this information with your pediatrician, because the more information we have, the more we can help somebody and treat them with better outcomes. So knowing a child's mutations can help both the parent and the pediatrician determine individual risk factors. For example, in the area of inflammation that I've referred to, if the mutation shows an aggressive inflammation with what we call broken off switch, that's another genetic mutation, a child may be more susceptible to any inflammatory effect, whether it's vaccinations or other causes, and possible effects on the immune system. This may lead to autoimmunity risk. We now know that we have identified over 100 autoimmune diseases in this country, and many of them, the foundation is inflammation. Similarly, if a child has mutations or weaknesses in the detox area, and we see this a lot in adults of course, and or what is called autophagy areas, that's the self-eating, the self-cleansing, they also may be more susceptible to any influx of viruses with their associated contaminants that could be coming from the cells of the vaccinations, but also any exposure out there for other reasons. Now, it's very important that we collaborate for the health of our kids. If you notice the statistics, just like I showed you with the different drugs that are being prescribed for our kids out there, very young kids, some pediatricians now are requiring a genetic profile even before they establish a vaccination schedule. They want to err on the safe side. Some physicians and other healthcare professionals are requiring a genetic profile for all patients as part of any diagnosis or treatment. Well, we like to stress again, this is information and very valuable information. For example, I know a lot of things about my young grandchildren, they're 6 and 8 now, that I'm using natural products and natural dietary types things that's going to help them avoid any potential problems in the future. The autophagy is important because autophagy is that self-cleansing, self-eating. Sometimes we use the example that you haven't cleaned your house for a month or so, the body starts accumulating debris, trash, doesn't get rid of the broken down proteins, doesn't get rid of the cells that are always turning over for new healthy cells. This is not only important for kids and, needless to say, for adults and longevity, but for kids. We know that now because we can actually do a PET scan, for example, and we can look at inflammation, which we couldn't do before, that we can see that there's inflammation in the brain. So we now know that inflammation has a lot to do with, for example, autism, but also ADD, ADHD, and other what are called neuroinflammatory diseases. But again, you don't know that if you haven't done a genetic test. So you don't know if your child is at greater risk or not for these type of things. The Nobel Prize for Autophagy is only 2016, so this is fairly new science. In 2015 was when, as my Dr. Stewart likes to say, the psych world was turned upside down with a PET scan. Again, we label what is called microglia, which are cells that can cause inflammation, and we can see it before disease happens. And genes, again, if you know if they're mutated or not, turn inflammation on and off. Sometimes they do it correctly, sometimes they don't. The difference now is pretty incredible, the rate of autism in this country. Now it's predicted it's up to 131 in 37, so every 37 child has some type of autistic disorder. That's over a 277% increase just in the last several years. And this book here, Autism and Vaccination, What's the Connection? I know a lot of people out there, a lot of government agencies and experts say that there is no connection, but if you have any questions, you might want to read this book. It's one of the ones, there's quite a few of them out on the market now, but that's one that you might want to educate yourself. Why educate? Because we all know in healthcare, education is empowerment. So the more you know about yourself and your children, the more effective you're going to be able to be for their health. Here just happens to be a website of a person that gives a nice, let's just say it's fair, it's a good treatment of the whole issue of vaccination and whether there's any link there or not. Looking at a particular gene, one that I found to be incredibly important is the GAD1 gene, and you'll find out if you do a genetic test whether your child has this or not. What that does, to make it fairly straightforward, it converts glutamic acid to GABA. The brain is always seeking homeostasis or a balance. Glutamic acid is what's called neuroexcitatory. It gets the brain going, motivated, sometimes too much. Or Dr. Almond, for example, likes to call it brain on fire. But it needs to be balanced by GABA, which is a calming hormone. There's over 40 million people now are affected by anxiety disorders, and again, even young kids are being put on anti-anxiety medications. There are many symptoms of having a deficiency in this particular neurotransmitters. Some of the symptoms you might see in your own child or yourself include insomnia, trouble sleeping, anxiety, depression, post-traumatic stress disorder is common, ADD and ADHD. All these are related to this particular gene. So if you know early on that your child has this particular mutation, there's steps you can take. And we're talking here about natural steps, nutrigenomics that I'll explain in a few minutes here, which is providing nourishment to the genes so they act correctly. The genes are basically proteins and enzymes. Genetic knowledge is doubling every 2 years, so the question is, are you on the fast track? Are you testing yourself, your children? Is your doctor testing you and your kids so they get this information? If not, you may want to ask about it or consider it for yourself. Now, what is nutrigenomics? That's a study and branch of genetic research on how foods affect our genes and how, in return, genetic variations, I call them mutations because it's sometimes called SNPs, affect the way we react to nutrients in food. So the good news is that the vast majority of our mutated genes can be affected positively by proper diet and proper supplementation with natural products. You are what your genes and what you eat. What your genes are and what you eat says a big role about who you are. So nutrigenomics is still considered an emerging science, but it's already transforming how we eat and how doctors and nutritionists can recommend diets. We are gathering more precise information. Candidly, a lot of what we did in the past was guesswork, trial and error. This helps eliminate some of that guesswork and some of that trial and error. So nutrigenomics helps us understand how our genes and what we eat interact and what it means for our health. For example, if you're what's called a poor methylation, that's providing fuel to our body, methyl B12 methylfolate would be a way to treat that. And also eating types of foods like organic kale, different salads and greens that also help provide folate to the body in this particular case. So again, you are your genes and what you eat. So our genes tell us if we're predisposed to certain conditions and explain why we might already suffer from these conditions and can't seem to find an answer. I know back when I owned various bioidentical hormone clinics, sometimes we couldn't help people. We didn't really have enough information to know why they didn't seem to be getting better. So ADHD, ADD, autism, autoimmunity disease, Alzheimer's disease, dementia, heart disease, all these can be in part related to genetic mutations that make you in a higher risk category. More importantly, in our genetic testing, we also can help you determine how you fix these things. Because it doesn't do you any good just to know you have a predisposition if you don't know what to do about it. Food is information. Food is information, the chemical language, which what our nature speaks directly to our bodies. Now our food, as you know, supply has changed a lot in the last several years. At my age, 73, I wasn't exposed to these type of pesticides and herbicides and genetically modified foods when I was young. It's a language that programs every functions of our cells, and food is more than fuel, it's chemical information. The problem is we're having a lot of chemicals added to our food supply, and we're also missing a lot of things like magnesium that we used to get from the soil and from our food supply. Unhealthy foods instruct the body, for example, to build fat cells. Foods with the right messages, healthy food, immediately start making us healthy because our bodies continually respond to what we do. Whether it's mental and you're giving yourself negative feedback, or whether it's food you're eating, the body's going to react to what you're doing, what you're thinking, and what you're feeding it. So every bite you take is either fighting disease or it's feeding it. Now here's a couple books. I love the Undoctored book by Dr. Davis. He wrote The Wheat Belly way back when and told us about all the dangers of wheat. He also stresses education and knowledge for everyone out there. Not the doctor, but you, how to take care of yourself, things that you'd want to know about. Again, self-help is one of the best things you can do for yourself and your children. Fat for Fuel just happened to be another one by Dr. McCullough. He has a great website, lots of information on health. So these are just a couple examples of some of the great books that are out there where you can educate yourself and learn more about eating, genetics, all these type of things. Again, remember, food is information. So the right information makes us healthy because, again, our bodies respond to what we do. Now, it's not all about genes. I know it's kind of cool for the child to come home and say, hey, it's your fault, Dad, I have terrible genes. It is in part probably related to the genes because they can affect our behavior. They can affect anything from anxiety to depression to sleep to attention to focus, but it's a big part of the puzzle, not the only part. So what are some of the conditions that are related to having mutated genes? By the way, all of us have mutated genes. Many of them have no negative effect on our body, at least as far as we know now. So it doesn't mean just because you have mutated genes that they're all bad. what we try to do with our genetic testing and Dr. Purser's genetic testing, we look at those genes that are what we like to call clinically relevant and provable in the clinics and with science and scientifically backed. And then we also can then say, okay, here's what we need to do to make this gene act properly so we don't have bad effects from it. So our genes again tell us if we may predispose to certain conditions, and again why we may suffer, but no one seems to be able to help us. Maybe we've already been to 3, 4, 5, 6 doctors. I know in the case of Dr. Stewart, who founded GX Science, the labs we happen to use in Austin, Texas, he treats a lot of severe autistic kids, he treats a lot of ADD, ADHD, and other neuroinflammatory diseases in adults. And he's designed these genetic profiles and these genetic tests that we're using. Again, all of these type of things, ADD, ADHD, autism, they're all in part related to our particular mutations. Poor sleep, brain fog, fatigue, low energy, you have a crash in the afternoon, you can't turn your brain off at night. There's probably a genetic mutation there that's affecting that. Digestive issues, IBS, leaky gut, these are all related in part again to having certain mutated genes that we need to identify, and then we need to say, okay, here's how we fix it naturally with nutrigenomics, with healthy foods, healthy supplements. Memory loss, poor focus, concentration, maybe for example your child's not doing good in school, maybe they don't seem to be able to focus at night on their homework. So these are all things that can in part again be related to mutated genes. Hashimoto's disease, thyroid, especially for the adults, other autoimmune, those are all in part related to genetic mutations. Whole list of things here. Pretty much genes run our life for us. Sometimes they can ruin our life because of the mutations that are untreated. And again, I'm not talking about treating with prescription drugs. I'm talking about treating naturally by feeding the body properly and giving it the proper nourishment that these genes need to act correctly. ADD and ADHD, we know it's big. I've treated a lot of kids with this. Dr. Alman has certified me as a brain health coach. Many of you have probably heard of Dr. Alman, a great doctor out in California. Over 6 million have been diagnosed, probably a lot more than that now, by the way. They say 5 to 11%, probably more for 11%. This one GAD gene I was telling you about, that can have a lot to do with ADD. Methylation, which is providing that fuel to the body, another area that we test, that can affect your body's ability to produce neurotransmitters. And neurotransmitters, of course, are key to ADHD. Adults have it too, by the way. Most adults with ADD weren't diagnosed as children. And a lot of women are definitely missed because they sometimes don't have the hyperactivity part. So we get confused sometimes. Hyperactivity is one part of ADD, and that's ADHD, and then you just have the ADD, which is focus and concentration without the hyperactivity. What I've found in our practices is typically if a child has ADD, one or both of the parents probably has the same thing. And that's a label we put on. It's really a deficiency in certain mutated genes and or treatment of the neurotransmitter. Now, genetic testing is really done for health, okay? You want more information. So we know again the diagnosis for ADD has increased a lot. Probably 1 in 10 children are affected, probably more in part because of our food supply, by the way, which plays a big role. We're getting a lot of grains and getting a lot of gliadins, all these different proteins that the body has never had to deal with before. We're still telling people to eat low fat, which is incredible because fat can be very healthy for you. Sugar, of course, is devastating. The cause isn't known, but we know of ADHD that genetics play a role. No question about that. We've tested way too many people. And again, 3 out of 4 children with ADD has a relative who also has disorders. We know genetics play a role. So if you're treating the genetics, you may not have the symptoms, the side effects, the problems that are associated with it. So think of genetic testing as solving a puzzle. Again, your ultimate objective is to improve your outcomes, to improve the treatment of this child. Instead of carrying them out in several different doctors, doing multiple medications, having them trouble in school, putting them in special classes, maybe we ought to just treat the, as Dr. Purser likes to say, let's treat the root cause, what is really causing this problem. So the question is, what's hidden in your puzzle? Do you have a time bomb in your genetic profile? You may. Without testing, you don't know. Is it the genes? Again, kind of like the child blaming the parent for this bad homework. It's partially both. It's environment, it's your lifestyle, partly genetic, or as this slide likes to say, and partly Boston cream pie in their case. So Dr. Purser is a doctor I'm working with out of Utah, incredible doctor, extremely smart, very talented. He's done these special profiles for adults and kids. In this particular example here, by the way, is a 1-year-old. I love teaching or testing, having young kids tested, because we can identify potential areas early on, and then we can start working with them early on with the proper diets and proper nourishment. In this particular case, methylation is that fuel to the body. This young man happens to have several mutations there in that area, so what is recommended for him is, of course, methyl B12, whether it's a cream to rub on or whether the proper diet. These are different ways to make sure that he doesn't have a methylation problem, which methylation problems can also lead to ADD and ADHD problems. The second part is B12. He also could use B12, whether it's a little tiny dose of B12 or just something in the future that you may want to consider with him, even though we may not do anything right now because of his age. Now this particular area is the methylation again. Notice this young man has even more significant methylation issues. Again, same solution. Methylation, here's a real complex diagram. I like to call it steps in a ladder. The body's trying to convert the food it brings in, the folic acid type form, trying to convert it to a form the body can use, which is the 5-methyl tetrahydrofolate, which is a nice fancy medical term for the form that you want. The answer to treating this, a lot of times, you give them that form in the first place so they don't have to worry about the step ladder having a lot of missing rungs or missing steps. And that's what this is steps in the methylation panel. Okay, so here again is another example. These are just different genes that we test. For example, this person, this young man, actually was very young, 6 months old. Very aggressive inflammation. That's that red. Homozygous means he has a mutation from both parents. He also has what's called, if you look down at the bottom, that CTLA4, that's an off switch. And the STAT4 is also an off switch. He has a mutation from both parents. So it's going to be very difficult. Once this child gets something that causes inflammation, whether it's an injury, whether it perhaps is a vaccination or multiple vaccinations, whatever particular causes this person to, there's an immune system to start protecting itself by creating inflammation, because we heal ourselves with inflammation, he's going to have trouble turning it off. So it's going to stay on, so the immune system is going to stay on. And if that happens, sometimes that leads to autoimmune diseases. It can also increase sensitivity to pain, and also it can lead to cancer in some more severe cases. Autophagy is at the bottom. That's that self-cleansing. He has some mutated genes there. Going back to the other child here, he also has aggressive inflammation. So not only does he have methylation, the fuel to the body, but he also has aggressive inflammation. And he also has that broken off switch. So that means that once it's turned on, he's going to have trouble turning it on. So the immune system is going to stay in a heightened state, and you don't want that for health reasons. And this particular young man also has a mutation in the autophagy gene, so he's not going to do very well about cleaning out his broken down proteins and things like that. So how do you treat it? There's different ways naturally. There's some supplements listed here, curcumin, dechiroinositol. These are different natural things, and you can get them from food supplies a lot, that will help the body react more properly to his mutated genes. It's kind of young now, but intermittent fasting is a great way to address this also for the future. Again, the star there just shows that aggressive turn-on switch, the IL-5, homozygous, and then the off switch broken. Lots of inflammation possibility here. This child also has mutated, means from both parents, homozygous, sugar sensitivity. So he's going to be react to sugar, and guess what? Sugar is very inflammatory, so we should be avoiding it anyway, whether it's synthetic or not. And so he's going to have that more reaction to sugar than maybe another child might. Also, the CTH is the body's ability to detoxify, to protect itself against herbicides, pesticides. So N-acetylcysteine is a natural product that can help there, but also avoiding herbicides and pesticides. Eating organic, eating things that don't have this high chemicals in them. So again, this is what it's telling us about him. So he's got the sugar sensitivity. Also at the bottom there, the same child, 6 months old, we know early on that he's going to have gluten issues, which gluten causes lots of inflammation and other issues. One way is just don't eat gluten anyway. But then this child's case is going to be worse because he's going to be at higher risk for that, for gluten sensitivity. And again, that also creates inflammation. So this child, unfortunately, not only has lots of mutated genes that are related to inflammation, to methylation, but also he has things like the sugar sensitivity, the gluten sensitivity, all mutated, both parents. It's going to make him a lot more sensitive. Good news is, we know this early on, so we know what steps to take. We all know as parents out there and grandparents that it's easier to teach some child to eat properly at an early age than when they start to get older. They don't always listen to us as well as they get older, or they start to develop taste preferences. Also on this same child, again, a lot of risk factors. He has that GAD1 gene. That GAD1 gene means he's going to high potential risk for ADD, anxiety, depression, brain crash in the afternoon, insomnia at night. This is a gene, again, that should have a combination of taking glutamic acid and converting to the calming form GABA, so it's in balance. He's not going to balance very well. He can, though, because we know Dr. Stewart, particularly, and Dr. Purser, they know what to do about it. That's really the key. We don't want to just test genes and say, hey, tough luck, you just deal with it. These esteemed doctors know a lot about this. They treat a lot of kids and adults, and they know how to help this person so they don't have symptoms. This 6-month-old, the doctor that tested him actually said, should I put him in a bubble? And I said, no, he doesn't need a bubble. He just needs the proper nourishment early on, and watch out for him as he grows and make sure he's eating properly and getting the proper supplementation. So what about the law? Who protects the rights of the parents? The children? We know that, unfortunately, that seems to be an issue right now. There's big money to be made in different things, including vaccinations, drugs. Lots of money out there, unfortunately. So follow the money, as they say sometimes. So who's going to protect you? Education. You're going to have to empower yourself with education. We know you can't sue the pharmaceutical companies. I don't know if you knew that or not. But you can't sue them because the Congress passed a law that gave them protection against any suits resulting from any injuries from vaccinations. So there's so many lawsuits that were filed that, as this one author says, the pharmaceutical companies basically blackmail Congress, saying they will stop manufacturing vaccinations if they're going to be sued for them. So kind of unusual that you get protected from these lawsuits like this. One of the experts for Big Pharma, he says that kids, that their baby's immune system can handle up to 1,000 vaccinations. I don't know who would believe that. That's just such an incredible statement. But he's also paid millions of dollars by Big Pharma. So whenever you listen to these experts, you might kind of check back to see who's being paid, who's paying them. Law firm, this is one law firm in Pennsylvania that's happened to get $101 million for measles vaccine that caused this child to suffer brain injury. And yet you'll hear a lot of people, including the CDC sometimes, that say, oh, there's no way that this causes any problem. Now, did he sue the Big Pharma? No. There was actually an agency set up by the government, but very seldom do they ever pay anybody any money. So it doesn't matter whether you have an autistic kid that you've got to care for the rest of your life. Most of the time they don't pay you any money because they fight not to pay money. This law firm happens to have to work through the system and did get money for this child. They've actually collected over $300 million for vaccine-injured patients. So then you wonder, if vaccination doesn't cause a problem, why is the government paying out all this money for these particular kids? And of course, again, they're not paying out for all the others. And we know Big Pharma is not paying because they're protected against lawsuits. And the Supreme Court, of course, upheld that, said, no, that's a law that we will uphold. So vaccine manufacturers can be protected from liability as long as they're accompanied by proper directions and warnings. And yet a lot of government agencies, including one in New York City right now, is mandating vaccinations. So you don't have a choice. They'll arrest you or charge you with a crime. So a major pediatric hospital said, we're not going to treat children if they don't get vaccinated. So A lot of things going on out there. Whatever your belief in is whether vaccinations are good or bad, and we think some of them are good, obviously. We think that should be an informed decision between you and your pediatrician. But you have to know the science and you have to know the risks so you can make an informed decision, not just look on the box that the drug company might put out to say, well, here's all these things that could happen. So there's different reasons why they may cause a problem. So do you want to know more? Do you want to be educated more? I gave you a couple books out there. There's a lot of great books out there with some really smart doctors. Are you interested in Dr. Purser's genetic health profile for kids? Young adults, not just for kids, but I say young adults too, teenagers, we've tested a lot of those. For adults, for yourself, here's a couple areas you can go to: Seeking Perfect Health, Dan Purser, MD. So if you decide you're interested in testing, you want to learn more, or you want to order a test, feel free to go to these websites.